We are really, I think, through the illustration of who's sitting here today, but also upstairs and watching on live stream, really trying to show the world how important it is to support this global army of entrepreneurs, the health transformers. I want to ask each of you a simple question, and it's both personal and professional, and it really is, what is your personal health moonshot? And then what is each of your organization's health moonshot?
Perfect. You want me to start?
Yeah, perfect. Sarah.
Thank you. I can't pick one, so I'm going to pick two.
Right.
And I think the first two on your list, access to care and the cost of care, I think the two are inextricably linked. I don't think that you can sustain and protect and ensure access until we make healthcare more affordable. So those are my two, and I'd say the beauty is that is perfectly aligned with our organization's moonshots. So it's a great privilege to get to work for an organization that's so aligned with my own personal values. And the only thing that I would add is that I'd love to see riddled throughout all of the moonshots is that we do all of this in a way that is just powered by empathy. So that's mine.
And before we move on to Marco, can you tell everyone in a snapshot who GuideWell is and why not only they're here, but more importantly, why you joined them?
Sure, fabulous, thank you. So the core of GuideWell, the nucleus of GuideWell, is the Blue Cross Blue Shield plan of Florida, Florida Blue. Florida Blue was founded at the end of World War II. So you can imagine that being a 73-year-old company that has aspirations of being around, being successful, and being relevant in 70 more years. This partnership with StartUp Health, we know that we need to both partner with and really nurture and incubate entrepreneurs to achieve that vision, and we really can't imagine a better partner than working with you guys. So,
thank you, Sarah.
Mm-hmm.
So,
Marco.
Same question for me. I used to be a physician in Australia, and it's a privileged place to be a sick person. It's a privileged place to be a healthcare provider. We kind of mastered access to care and cost of care in 1975, and we went to single-payer, nationalized healthcare. We've never looked back. We're at half of the US GDP. So my personal inspiration is bringing some of that magic that we realized 40 years ago in Australia, bringing that to the rest of the world. I'm currently now doing this for Ping An in China, but it's the same idea, and it's the same the biggest two moonshots that most of your portfolios are focusing on. Really doing something to the cost of care and bringing this down by a factor of 1 million, bringing it as close as possible to zero, and providing access to good quality care to a greater number of people.
And ask the same question. Why did you join Ping An on this mission that they're on?
Right, so I've disrupted my family. My 2 teenagers hate me for taking them out of high school in rural Pennsylvania and putting them down in Hong Kong. But I think, apart from the personal challenges and opportunities there, I think when you get a chance to work in a country of 1.4 billion people, when you have 400 million people in the rural areas who don't have access to the kind of healthcare that we take for granted, when you're working in a system with 0.3 primary care doctors per 1,000 instead of 2.3 as we have in this great country, you begin to realize we need some innovative tools and technologies and business model changes to be able to get access and to get costs down. So it's a huge challenge. It's the kind of thing in the middle of my career that I feel that I can really make a difference to a great number of people.
And Marco, I have 3 teenagers. I can assure you they'd hate you anyway.
Sarah, when you first heard about what we're doing here at StartUp Health and this idea that we're organizing this global army, from GuideWell's perspective, how do you want to support the entrepreneurs beyond being a partner with StartUp Health? I know GuideWell is so much more. Can you describe a little bit about GuideWell's mission over the next couple of years as it relates to, most importantly, innovation, startups, entrepreneurs?
Fantastic, thank you. So I mentioned earlier the nucleus of GuideWell is the Blue Cross plan in Florida, but we actually have 4 other divisions. GuideWell Connect, which focuses on consumer engagement. It's a B2B business that sells sales and marketing tools to other health plans. We have GuideWell Health. We actually own bricks and mortar primary care and urgent care assets all over Florida. We also own a separate staff model HMO. We recently bought a population health management company, Pop Health, and then our last division is GuideWell Source. We're actually the largest processor of Medicare claims in the country. But as we look to the future, our aspiration to really be a full-service healthcare consumer engagement, healthcare innovator, healthcare services organization to meet the needs not just of Floridians, but to actually really partner and try to drive those two moonshots we talked about, ensuring that there is access to affordable, high-quality healthcare. That's really who we are and what we're about. And as I said earlier, can't imagine anyone, as we're looking to forge relationships and learn from and nurture entrepreneurs. That's what brought us here. Our relationship precedes this investment, but we're really happy to be taking it to the next level. With a lot of credit, I see our CFO sitting in the audience over there, Chuck DeVita. So enormous credit to Chuck for supporting our investment.
Chuck, support. Always got to support the CFO.
There you go. Exactly. I know who has the checkbook.
Excellent. So, Ping An has announced, I guess about almost a year ago, $1 billion commitment to support global innovation, in particular in, I guess, fintech and health tech.
You bet.
Can you talk about just that being the beginning of kind of something much bigger, and really why Jonathan and yourself and your team are so committed right now in such a big way to transforming global health?
Sure, and it starts 29 years ago with our founder, Peter Ma, or Ma Ming-je, who founded a property and casualty insurer with something like 13 employees. He's grown that at something like a 23% compound annual growth rate over 30 years. It's now worth $200 billion. It's the world's leading insurer by market capitalization. We've built enduring and deep and strong relationships with people through property and casualty and through life insurance. We want to extend that trust. Peter Ma wants to extend that trust to offering financial services, personal financial services, and probably even more importantly, healthcare services. So in the last 10 years or so, we have 4 or 5 business units that are working in healthcare. We have the world's largest telemedicine platform, 170 million registered users, about 5 million daily active users. It's an online to offline model. We have physicians using human capital to answer questions. Obvious extensions are the kind of innovators you see around us in the room, thinking of ways to introduce AI there for symptoms checking, for automated diagnoses, for protocol-driven care. We also have 50,000 clinics that we provide enterprise services to. We serve the state health insurance funds of 230 big cities, about 600 million citizens, very similar to the fiscal agent, the Medicare fiscal agencies that you're doing at GuideWell. And we have a small but growing 2 million subscriber commercial health insurance business. Across all these businesses, we realize that we certainly have no monopoly on innovation and talent and capabilities. We look around the world, we look at the innovators in the room and the innovators that will be onboarded in the future at StartUp Health. And we look to the leadership of Stephen and Unity, the rest of the StartUp Health team, to train these transformers. And I can just say, just speaking personally, having reached out as late as Friday to have set up half a dozen meetings today and tomorrow with well-qualified, curated, vetted startups that have the ability and the motivation to work with us, it's a huge advantage. We could never duplicate the effort it takes to identify, onboard, train, and prepare those innovators to meet with investors. So we're extremely grateful. We see, as Stephen said, the $1 billion that's out there as being just the first tranche of funds that gets deployed in the next 3 years. I'm personally hoping to deploy about $170 million into health tech per year.
Can you repeat that a little louder?
170, and that's my personal target. My private target to my boss was more modest at 120. That's in my KPI, but we're clearly hungry for the innovation that we see in the room. We want those batteries included transformers to be working with us. We want to introduce them to our market. We want to work with them. Not just as a financial investor, although that's important, but more as a strategic partnership that helps us and helps our customers. And it makes the world a more beautiful place. And at the end of the day, that's what we're going to go down with. personal aspiration.
Excellent. I love, you talked about Batters Included, so I want to circle back to that. We talked about it all day, especially this morning as we launched the festival. We always talk to our entrepreneurs in Startup Health, the health transformers, about the importance when selecting partners, whether they're investors or customers or distribution partners or advisors. Look to the organization's leadership to see how much they really buy into working not only with entrepreneurs and startups, but how committed are they to the transformation of healthcare. You mentioned Peter and Jonathan and Patrick,
Yep.
leaders of your respective organizations who I know from watching, reading, listening, and meeting them that they are truly committed. There is no level in the organization that all of a sudden there's really no interest in this kind of innovation. Can you talk a little bit about each of your respective CEOs as it relates to their mindset and how important it is to them to embrace entrepreneurs in the transformation of healthcare?
Go ahead.
Okay. So, about 2 months ago, I was in Shenzhen for the annual Executive Council meeting. It's the top 300 managers at Ping An. If that had been a Western Executive Committee meeting, we would have spent 2 days talking about the past. We would have congratulated ourselves on our achievements. We would have gloried in whatever we'd done. Not a word was spent on that. It was the next 30 years, right? So Peter's looking decades into the future. As a guy who's in his early 60s now, he hasn't stopped thinking about how to transform the healthcare industry in China or the financial services industry. He's committed and has a vision that gets mirrored down, to your point, at all levels of organization. So I feel very blessed to work in a company which interviews personally most managers, get 45 minutes with the chairman. That shows you that depth of commitment to identifying the talent to operationalize the vision.
I think what's incredible is that so few companies of your size, of the company's age, are still run by the entrepreneur who founded the company, which is crazy awesome for an entrepreneur to know that the organization gets entrepreneurship because the founder is still running the company.
Yes, sir.
So in addition to working with this incredibly strategic CFO, our company is led both by, I know, I told you I'd embarrass you. Our company is led both by Pat Garrity, as you mentioned, our CEO, but Renee Lehrer, the president of the company. And it's just a phenomenal leadership team. And as an indication, I get on a plane. My kids are in Boston. I get on a plane every Monday morning and fly to Florida and spend 4 days a week in Florida and then go back to Boston because the commitment of the leadership there to really make the healthcare system better, not just in Florida, but more broadly, is something that I see materialized in our organization every day. Through the Affordable Care Act, we actually have more people enrolled than any other health plan in the country, to my knowledge. So of that 10 million or so people who were insured through Obamacare, not through the Medicaid side, but through the exchange part of the ACA, we have 1 million. So this is an insurance company between our Medicare business, our Medicaid business, and our exchange-based business, and just the nature of the Florida population is miles ahead of most other insurers in terms of really understanding the need to relate to consumers and to really transform our business model to relate to consumers. We have almost 24 retail centers. These are not providers. These aren't physician offices. These are literally bricks and mortar buildings that say Florida Blue, where you can go in, you can buy insurance. If you're having a problem with your claim, you can walk in the door and have someone troubleshoot it with you. You can see a nurse if that is something that you want to do. There's all kinds of innovative wearables that sit out on a counter to be demonstrated by folks in the retail centers to get people more engaged in their health. And so that's just one indication of our commitment to really thinking about how do we take an industry and a product that I know is one of the most frustrating industries for most consumers. And when you look at the Temkin survey, we're number 19 as a sector. The only business that's below health insurance is internet and cable service providers. That's not where you want to be. So being a part of a company that's really investing resources in, thinking about, I talked about wanting to be in an industry and apply the notion of, radical empathy to the moonshots. That's really how we're thinking about the next phase of our business.
Well, we could not be more excited to have you join the Startup Health family as our newest investors who continue, I think, for us to be able to show the world that selecting great partners is the most important part of the journey of any entrepreneur. The kinds of supportive organizations from the top down that really aren't just about banners and headlines and marketing, but really doing the hard work that it takes to really make an impact. And so really, welcome to this journey with us. I hope you're having a good time here, and over the next couple of days, if you have a chance, get to meet both of them who will be here, and we're really looking forward to being on this journey with you. Thank you again for leading this latest round of financing, and really welcome to the family.
Thank you. Appreciate it.